Welcome to Medical Matters Weekly with Dr. Trey Dobson, presented by Southwestern Vermont Healthcare and Catamount Access Television.
Welcome, everyone. Today is August 29th, 2022, and we are recording this show for August 31st. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. I'm excited about our guest today, Dr. Matilde Castiel. Did I pronounce that right, Maddie?
Correct. Very good.
She is the Commissioner of Health and Human Services for the City of Worcester, Mass. And she has a long bio here. I'll just give you a couple of highlights, and you can look online at the full bio. She completed her residency at UMass Memorial, worked as an internal medicine physician with UMass Memorial Medical Center and Family Health Center of Worcester, and served as an associate professor of internal medicine, family medicine, and psychiatry at UMass Medical School. And she founded the Latin American Health Alliance. It goes on and on. She's been honored with many awards, including Public Citizen of the Year Award, which is really cool. Did you get a big cape with maybe Public Citizen written on the back?
Not quite, but it was nice.
And then instrumental in the City of Worcester being honored with the 2020-2021 Robert Wood Johnson Foundation Culture of Health Prize, which is a really big deal. So thank you so much for joining us today.
My pleasure.
Tell us a little bit, well, first off, where are you right now? You're in your office?
I'm in my office. I probably should remove the picture of my grandson who's here. I have a 9-month-old, he'll be 9 months at the end of this month, grandson. So that's my first grandson. So let me see.
No, remove it and place it closer so we can see.
There you go. That's my grandson.
Tell us a little bit about where you're from and the story that we've heard about how you came to the United States.
So I'm originally from Cuba. I was born in Cuba, and when I was 7 years old, I left Cuba in what was called Peter Pan expeditions, where about 4,000 kids left Cuba. And my parents stayed behind. So my 8-year-old brother and myself came to Cuba. We were supposed to go to Boston. And my mother had written to all our sponsors here in the United States saying that I was allergic to cold and to down, and I couldn't be in somewhere cold. So we had flown to Miami. And that's from there I was supposed to go to Boston, but because of those letters, I ended up going to California. And so I stayed in a foster home in Lakewood, California. And shortly thereafter, my family came and we were reunited and grew up in California. And only to come back. Yep, only to come back to Worcester or to Massachusetts, where my husband, who we met in residency in St. Louis, said he wanted to try New England for 2 years, and that's been 33 years ago.
Oh, wow, that's fantastic. And is your brother, you mentioned your brother, is he still in the United States?
He's in the United States. He's in California. He's an accountant in LA.
And you did your medical training in San Francisco?
Correct.
I just mentioned that because I saw it on your bio, and I was there a couple of weeks ago for the first time. So I got to see the area. So it was nice.
Beautiful place.
So what drew you into medicine?
I think when I was young, sort of a lot of the stuff that my dad would do, he worked in neighborhoods, Latino neighborhoods, and he was a salesman and did, basically sold things out of his car. And so I got to meet people in the neighborhood. Plus, I was also my parents' interpreter when we went to the doctor's office to take care of any issues that he had. And so I really got involved in that whole process and sort of wanted to see how I could help through that matter. But I didn't think that I could go through med school. I didn't think that was something that I was capable of doing. But later on, I got a job in high school as a pharmacist and worked as a pharmacist tech and ended up seeing some heart surgeries live on the amphitheater. And I thought it was the coolest thing to be able to do that. because I thought I met the guy beforehand, so I knew him as a person, and then I got to meet him inside, as I would say. And that was incredibly a beautiful experience to know somebody from inside, literally from inside and outside. So I got really fascinated with that, and then I just decided that I was going to pursue it.
And then so much of your work has been with underserved communities. And what do you think, was that from your background in immigration? What drew you to working with underserved communities?
I think it was that. I think that's, that's who we were when we came to this country. And so, my parents worked in factories. We were, we were trying to make ends meet, and everybody we knew around us was in the same situation. And so I think that those were all part of it. Plus, I think that, I don't know, I think we just had a desire to help people, to improve people's lives. And that was something that my dad was really passionate about and sort of passed on to me. And so we did a lot of sort of going out into the community together and talking to people. That was what he liked to do. And so I used to go to work with him, and it was sort of a neat thing to do. But I always said that this is what I want to do, and I wanted to go back to the neighborhood and work there. So I did spend a year or two working at LA County General Hospital, during my stint in med school. But I really enjoyed working in the community.
Well, I tell you, it is very admirable. And, a lot of people, at least I found, like in a lot of my peers and going through the process of going into medical school, it's sort of a romantic idea. People want to do that. They want to go into helping underserved areas, whether that's underserved in the inner city or underserved in rural communities or underserved by a specific type of diagnosis or a specific ethnic background. But you can lose that. It takes a long time to get through medical school and then residency. You can sort of not lose the desire, but lose that focus, because now you're focused on the next part of your life. And so, again, it's admirable that you continue to work with it. And now you got involved as the Commissioner of Health and Human Services. So most doctors do not do that. How did that happen?
Well, I always, in the back of my mind, I think seeing patients, you realize what some of the problems are, and you want to do it for all people, right? You want to do it for the community, for people who have diabetes. I want to make an impact in those kinds of things, but in a grander scale. But never thought otherwise about this position, except for somebody who was a city councilor here actually handed me some applications and said, "This would be a great job for you. I think you should apply." I said, "I'll never get anything like that." She said, "No, I think you should apply." So I applied, and here I am. I think September will be 7 years that I've been here. So true, I've enjoyed every process of it. I think just had a meeting today to talk about some of our frustrations, because I think everybody gets frustrated because there's so much that we want to do, and it's a slow process moving forward. We want to change everything as quickly as we can, because we've seen the outcomes of what happens when we don't. But it's a process. We deal with homelessness, we deal with addiction, reentry, people coming back from jail. We've, the whole COVID piece that we dealt with, but we had a task force, and we turned that task force into the equity task force. So really, the biggest issue is, how do we bring equity into the community, and what are the things that we need to do differently to bring that? And I think that's a lot of our conversations. That's a lot of our work. But at times it's frustrating, because it just doesn't happen as quickly as we want to. We get a lot of pushback, but I also love the ability to continue to push, but it does sometimes get, okay, we're tired right now. Let's think about another method of how do we do this. So we're constantly doing that.
So connect with me. I know states differ a little bit in this regard, but with how you're connected with the state, Department of Health. So
right now we have, we started a couple of years ago. The 14 largest cities got together, and it was really something that a few of us thought about, and we've talked about it. And ultimately it came to fruition. And it's been a group to think about how we all work together and how we all make that progress moving forward. And that's how we've worked with the state. And most recently, we decided that we're going to go independent. So we formed the 14 largest cities, and we have a board now. And so we're looking to move forward, because I think together we'd like to, whatever changes we make here in Worcester, we want to make sure that we can create those changes throughout Massachusetts. So.
And I don't want to get in the weeds too much. I'll just ask one more question, just for my own personal. So your funding is separate then from the state health department, basically.
Yes. Yes. We have grants from the state health department that we have a team who works on those particular grants. But really through my office, I have in particular here, I run homelessness. We run what's called the governance and the hub, which is really, again, people who's the most vulnerable people in our community. But how do we work with all the agencies to, as I say, wrap them ourselves around them to make sure that that person who we identify as having high risk factors actually goes into treatment. And governance is really all the people from the different agencies, nonprofits in the city that we present topics to, that we want them to understand, and how do we move those topics forward, whether it's topics on reentry. We just recently did a safe consumption site, so that people are aware of the things that are people are trying to move forward. Where are we in some of these processes to keep, dealing with it? How do we deal with trauma in the public school system, suspensions in the public school systems? What do we need to have in those? So those are the kinds of presentations we give to governance. And our homeless group is really doing outreach. We have recovery coaches that are hired by the city to go out and hopefully help people with addiction get into treatment. And support them through that process. So those are just a little bit of at least outside of the 5 departments that I run. Those are some of the things that we do here internally.
Boy, that is truly public health. I mean, you just hit all of the major sectors there. Not to dwell on the pandemic too much, but did you see a lot of change in Worcester and your focus and your staff's focus during the initial stages of the pandemic?
I think we were incredibly scared during that time, because we didn't know that much about this virus. But I probably think it was, and I hate to say it this way, but it was probably one of the more exciting times that we've had here, in the sense of all the things that we did together as a group. And so we opened up shelters. We had COVID positive shelters. We vaccinated, we tested first all of the shelters, and then when we got the vaccines, we went out into the community. We had what was called the equity vaccine. And so we went everywhere in the community. We actually walked down the streets and went into markets and vaccinated people. And it was just, to me, it was what public health was. But at the same time, I think we were scared. We didn't know, but it was also real rewarding to help the most vulnerable in our community. And so I'm grateful for that. I think I look back on it as an amazing accomplishment that we did here. I certainly don't want it again, but it was truly public health. And what it did was, we had United Way had a group called Worcester Together, and they came together and they helped. We had a COVID-19 equity task force, which was between UMass, the City of Worcester, and then everybody else in community. So the hospitals, the health centers, and really worked together for the first time. And I think of all the things that are positive about COVID, truly was that we all worked together. And I'm trying desperately not to have it go back to the way it was, and that we continue to work together. And we have done that so far. We got together to even talk about monkeypox and what are we going to do, and what are the hospitals and the health centers doing. But that's the way it should be, that we're all working together. So I guess that's what I hope that we continue to look forward to. And then also to think about how we go out and reach into the community. How do we get this information out into communities of color? And it isn't just with flyers. It isn't just with, we did enough by going, we went to the area, but I think there has to be a deeper outreach into the community, block by block, house by house, that we are part, whether it's nurse practitioners and community health workers that go out into the community and really get to know people and what are some of the issues so that we can assess them and we can work with them and help them through that process. So I look at medicine a little bit different now, that we have to go to people instead of people going to healthcare, into the hospital.
You said an exciting time, and it's okay. I think that's totally appropriate to have exciting times during mass casualties and disasters. It's exciting in the sense of what can we do to be effective, and I think we all have to learn from each other and study what was effective and frankly what wasn't effective, which is just as important. Some places, whether it was public health or certain organizations, were especially initially on, they were at least either paralyzed by fear and then therefore unable to be effective, or they were so complacent and in denial that they were unable to be effective because they made so many mistakes. And so it sounds like, and by the way, the differences here and the way to move forward is through strong leadership, which is likely, I am sure, from yourself and others, what made you successful, or your efforts successful. That's the first. And the second, of course, is like you say, collaboration. Everyone, all different sectors, all different facets, whether it's a focus group on providing food or a focus group on actually attending to maternal fetal situations, working together and not in silos. It's easy to say, it's hard to implement. So again, congratulations for that.
Yeah, no, and I agree with you that those, the idea of going out and really helping people was a plus. And I don't want to minimize any of what happened. I also had family members who passed away during COVID, and certainly don't want to minimize any of that. But I guess I stressed the fact that it was important for us to really go out and do the work in the community, and it's really why we're here. So I think it was a different experience, and I think it taught us a lot. And like you said, this is how we learn through the process. So what are we going to do next time, and how are we going to change that? Yeah.
Tell us a little bit about the Latin American Health Alliance.
So back in 2004, there was a group of people who got together to talk about some of the violence that was happening in the main South area, which is a big portion is a Latino community. And we came to the conclusion that addiction was the issue, and that the numbers in the Latino community were increasing, and they did not feel comfortable in treatment facilities because they didn't speak the language, or the food wasn't the right food. And so we got together to figure out how we put a treatment facility together. Hector Reyes was a gentleman who was he himself suffered with addiction. He had recovered. And he really was somebody who was helping the Latino community, especially Latino community who was suffering with addiction, to help them through that process. And this was one of his dreams, was to put a treatment facility for Latino men. And so we worked together to put this treatment facility that's funded through the Bureau of Substance Use for a 25-bed. I didn't know that much about addiction. We never got trained a whole lot in addiction when I went through medical school, but I certainly did a lot of reading and a lot of work on it. And it certainly became something that I'm incredibly tied into, feel a whole lot about it. So in 2009, we opened the treatment facility, and unfortunately, Hector Reyes died July 4th of 2009. So I've sort of, with him in my heart, we keep moving forward and continue to have this program. We have 2 transition houses. We have a restaurant, which is Cuban, because that's the only thing I know how to do. I always say is I know how to practice medicine, and I know how to cook Cuban food. So I taught the guys how to cook Cuban food. And it's a job training program for the men in recovery. But we also did the 2 transition houses. Again, people, especially communities of color, are released from jail. They don't have an education. They don't have any job training, and they have a quarry. So difficult to find jobs, difficult to to give people purpose in life, and people who've been incarcerated for 10 plus years. And so I think there is also that stigma that people won't accept them. And I think one of the good things about the restaurant is that it brings people in recovery, people from the program, to meet with people in the community so that they realize that there's no difference between them and anybody else. You wouldn't know that somebody's in recovery. And I also, I think I do a lot of work in the med school trying to talk a lot to the med students about, to look at the problems that they see in the community and how do they solve those issues? What things can they do in the community to solve it? And I think that that was one of the things for me that was incredibly important, and we just kept on building. I mean, I think, and I did this all as a volunteer. I still had my, my practice. I didn't work for them. I was a volunteer the entire time. But it was, oh, we don't have housing, they can't afford housing, and so we put a transition house, and they can't get jobs, they don't have job training, let's give them job training. So it's all the things that we can do. And I think as physicians, we have the ability and the power. I remember asking for money because we couldn't access the grant from the state unless we had some funding, and we had no funding. And so we knocked on doors and found a bank that actually said, I'll give you a line of credit that we never used, but we were able to access the grant from the Bureau of Substance Use, and that's how we got started. But it's probably been the most rewarding thing I've ever done. To see people's lives change is incredible. And I call them all my sons. They call me mom, because it's like you're raising your kids. So it's just because you given them that trust and you care about them and how they do. So it's a great thing. So I'm here as commissioner, also trying to figure out how we improve addiction care in our community and how we all work together through that process. Same as reentry from jail, thinking about what are we doing there, and do we need to spend X amount of times there? And if we're there, what's the treatment you're giving? And what are job training things that you're doing for people so that when they leave, they can actually function?
Right, and be contributing members of society. And I say those terms because sometimes people, they don't really mean it like this. They say, I don't know why you're putting all your efforts into this type of work. And it's easy for me to respond, or my colleagues who are doing work like that. Well, we went into medicine to end suffering, and there are many ways, or at least to limit suffering. And there are many ways to limit suffering. And one is to give people the opportunity to get back into the community and contribute. And I hope that appeals to even those folks who may think it's a quote waste of time. It's not at all, because these are humans who can contribute. And in fact, like you said, there are many people that others have no clue, have been through, have been down, have been through addiction, and have recovered, or jail, and have recovered and leave meaning. Not only do they live meaningful lives, they contribute to advancement, and that's so important. Real quick, you use some data. I'm looking at my notes here. You use data, or Worcester uses data to support population health efforts. Can you just comment quickly on why that's in my notes?
Oh, I think because it was a COVID-19 equity task force that we knew real-time numbers that were happening. We knew where it was. We knew what areas we needed to focus on, and that was important to what we did with COVID. But we're turning that COVID equity, that COVID-19 task force, into the COVID equity task force to really look at the inequities and see what the data is on that. We're just in the process of getting a vendor to be able to tie in all the EMRs together from the health centers and the hospital, so we can pull out that data, because without local data, we can't function to the same degree that we could, getting state data. So it's an important piece. I think that's also a piece of what the 14 largest cities is trying to do, is get local data for their cities. So that's where we were, but it was really what COVID did for data that was incredibly important, to be able to see real time and where to go. That was important. So what neighborhoods, and that's what really helped us through that time.
Yeah, I couldn't agree more. I mean, it's one of the problems, and you drive public health initiatives, or frankly, any public initiative, is what motivates you is your heart, but you have to lead with looking at where the data says to go, not just where your heart does. And as an emergency physician, I see things that are not really representative of society because it is selective coming into me. And I know that, and I think that's so important. Do you think that was a part of the reason that Worcester received the Robert Wood Johnson Foundation Culture of Health Prize? I know there's many other aspects to
I
that.
think that, yeah, I think that there's a whole lot of reasons. I think that certainly we're a diverse community. I think our ability to work together, all the different organizations, if I think about Southeast Asian Coalition and what they do in the community and how we collaborate together, or Legendary Legacies that mentors young men, all of these things are what different nonprofits do in our community, and all sort of, you can say, rowing in the same direction, really to end inequities that exist. And so I think that's, I don't think I've ever seen it in other cities, and I'm sure there are, but I haven't, and to the degree that we have here. We have just the right amount of population where everybody knows one another and that we can work with one another, and listen to each other's ideas, and try to improve them. So I think it's all the different organizations that exist in Worcester, that work together to help the community.
Yeah, and we really can make a difference. It's so, things can get pretty bleak these days, and having that optimistic viewpoint is so important to motivate and inspire us. Tell us what you're looking forward to, either personally or professionally, over the next year or two.
That's a good question. I was thinking once upon a time, a couple of years ago, I wanted to be the czar of drugs. I wanted to do that, the advisory to the president for drugs. So that didn't pan out. But I still like to continue working on addiction. I still like to work with the men in the program. And I still, there's so much to do here. My family asked me, when am I going to retire? And I don't see retiring at some point. I think that it is, to me, this is really exciting. It's exciting. It's rewarding. I think the combination of the two. I still do one day a week clinic at the Hector Reyes house. So I still practice a little bit of medicine, and I get to see patients and talk to the men. And so I enjoy that very much. And here constantly, I keep telling all my staff, we have to change the world. And so we keep working and trying to improve what happens in our community. And hopefully we will become a role model that can transform other communities. So that's what I look forward to. So I doubt I'll be retiring at any point soon. Don't tell that to my husband, but this is my, I like what I do.
Oh, Dr. Castiel, thank you so much for joining us.
Thank you. Thank you.
I'll also thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, Ashley Jowett from Southwestern Vermont Healthcare. I'm Trey Dobson. Go out and find joy in everything you do. Change the world. And we will see you again next week.
Thank you.